spotlight focus today on India Today is on the rise in diabetes cases among COVID patients. If you're having a tough time dealing with complications arising out of COVID-19, the complications are multifold, many more for those who already suffer from diabetes. And most people are still decoding the COVID-diabetes link. Take a look at this comprehensive report by India Today's Sneha Mordani.
77 million Indians are diabetic. India is the diabetes capital of the world. And when it comes to severe infection, diabetics are feeling the heat.
What we have seen so far is diabetes do have a compromised innate immunity, which results in delayed complement fixation and altered phagocytosis. So diabetics need to be a little bit extra cautious in terms of getting about or moving about in the COVID pandemic, and need to exercise all restraints and precautions to prevent the infection of COVID from coming in the first place.
Poor glucose levels compromise insulin production and suppress immunity. Diabetes make it harder for nutrients to be harnessed, leads to poor blood flow, and the virus can easily invade lungs. High blood sugar aids this. Poor blood glucose levels can help the virus attack the pancreas and make diabetes worse. Diabetics must look out for skin rashes because they are more prone to skin infections. There is slow healing from these wounds. The most commonly talked about infection now that diabetics are getting even after recovery from COVID-19 is mucormycosis or black fungus.
It is mucormycosis, which is a so-called black fungus, which is the most damaging because it can start from the nose and sinuses, goes up to the eye and in the brain. Once it occurs, then there is a high chances of fatality. So be careful. Talk to your physician. How soon can we decrease the steroid and stop the steroid, and how best we should control blood sugar using drugs and insulin.
Well, doctors say it is advisable to get protection soon. So get the vaccine as soon as you can if you are diabetic. Maintain a healthy weight and keep your sugar under control. Manage diabetes well to prevent getting severe COVID infection. In New Delhi, Sneha Mordani for India Today.
Let's tell you about the COVID-diabetes link, and the reason why we are dedicating a full show to just diabetes is because of the following reasons. Diabetes is one of the major comorbidities in COVID patients, not just in India but around the world. A high percentage of COVID patients have diabetes as a comorbidity. Diabetes patients are seen to have much worse complications during COVID. Diabetes patients are seeing a recovery that is much slower than those without diabetes when they get COVID-19. Diabetes patients are also more vulnerable. This is what experts say. More vulnerable to post-COVID complications, including things like the black fungus disease. They're more vulnerable to, like I said, the black fungus or mucormycosis. So there are many risk factors if patients already have diabetes and then they contract COVID-19. Now, why is diabetes such a specific COVID alarm? Every country in the world, people with diabetes are being given special warnings as far as COVID is concerned. Now, here are the reasons. Persons with diabetes may or may not already know these, but for the benefit of everyone concerned, because diabetes can happen even after COVID. Blood sugar weakens the immune system's ability to fight COVID-19. It's as simple as that. People with type 1 diabetes, which is the more serious and rarer kind of diabetes, are more at risk than the more common and less dangerous type 2 diabetes. Extreme cases of diabetic diabetes patients face things like sepsis and septic shock. Diabetes patients with COVID-19 face an increased risk of a condition called diabetic ketoacidosis, which we'll talk about in more detail going forward. And also diabetes along with heart disease or other underlying conditions raise the risk significantly of the kind of extreme symptoms you may face when you have COVID. Now, the cases seen of new diabetes this is actually one of the more disturbing things. There are cases that have been recorded in the world of people contracting diabetes, the onset of diabetes, which was not previously there, after you've recovered from COVID-19. So this is one of the reasons why diabetes is a big sort of a disease that needs to be underscored when we're talking about COVID-19 in that context. Now, what are doctors advising diabetes patients here in India and around the world? We've collated it for you so you get a sense. Get vaccinated as quickly as possible. That's one of the fastest pieces of advice that diabetes patients are getting anywhere. Get vaccinated as quickly as possible. Take extra precautions in daily work and life. Because of the nature of this comorbidity, because the fact that you have diabetes will ensure you have worse symptoms than someone who does not have diabetes, means you need to take extra precautions. Even if you are slightly anxious, if you are a diabetic, and even if you are slightly anxious, consult your doctor immediately. You should not wait at all. Early intervention wherever possible. Here's the good news. Well-managed diabetes can help you avoid serious COVID complications. So that's one bit of good news. But overall, if you've got diabetes, it definitely worsens your chances of avoiding serious symptoms and complications. I'm joined now because we've got two patients. We've also got two doctors who've been advising COVID patients with diabetes. And I want to discuss threadbare not only what the experience is, but what people can look out for. And this show is designed not just for people with diabetes, but people who are concerned because they might get diabetes in the future and how to avoid it. Chandani Chawla is a type 1 diabetes patient and a certified health coach from the Institute of Integrative Nutrition in the US. Dr. Vishakha Shivdasani is a physician and a lifestyle diseases expert who specializes in advising people against things like diabetes. She's also the author of a book on COVID and post-COVID recovery. Dr. Akhilesh Sharma is a very well-known physician from Bombay Hospital in Mumbai. And Bhaavna Arora is a well-known author and influencer as well as a type 1 diabetes patient. Welcome to all of you. Chandani, I'd like to start with you. If the doctors will permit me, I'd like to hear from both the patients first so we get a sense of the experience here. Chandani, diabetes and COVID, is something people have heard on and off about for over a year now. What has your experience been? Because the diabetes as a comorbidity has, rung the alarm bells right from the beginning of the COVID pandemic.
Thank you so much for that question. I believe as a type 1 diabetic, it is very important, of course, to understand that you will have crazy complications if you do get COVID, but also to take account that you must follow the life the way you're following. And the biggest drawback, I believe, with COVID, with not being able to leave your house and not being able to go to work, is what we go through, a diabetic burnout, which basically means where, okay, I'm not going to work, I'm not doing this, I don't want to check my sugar at the same time. The main thing to keep in pause is having your routine and making sure your sugar is in balance. Absolutely.
Absolutely. Bhaavna, what has your experience been like? You've been a type 1 diabetes patient for, for over 25 years. When the COVID wave began and when you started hearing about how diabetes patients are especially vulnerable, how did you handle all of that? Were you prepared for all of that?
Hi, Shiv. Thank you for having me on the show. I really wanted to speak about all this because, till now, I really didn't feel the need to talk about type 1 diabetes, despite the fact that I'm a type 1 diabetic for the past 27 years, maybe. Don't ask me when I got it. It will reveal my age. Yeah, so talking about, COVID and type 1 diabetes.
Yeah.
I have suffered the first wave of COVID-19 and I was tested positive. Fortunately, okay. I've been able to escape the second wave, which is more deadly. But yes, it is very, very scary, especially when you get to hear and when you yourself have experienced all these factors of having low immunity, with your blood sugar levels rising. And trust me, type 1 diabetes is not like type 2 diabetes. It is very, very brittle. You need to keep your blood sugar levels under control throughout the day. It's not like aaj fasting normal hai to pura din normal hoga. It doesn't work that way.
What were your symptoms like, Bhaavna, as a diabetic who contracted COVID? What were your symptoms like? Because doctors have been saying from the beginning that if you have diabetes, the chances of you having, worse symptoms and becoming much tougher to recover is a fact.
Shiv, touchwood. So I'll tell you what. I mean, I'm here on this show at least, not just to talk about diabetes, but also to encourage so many other type 1 diabetics who could, take my example. And my fight with type 1 diabetes has been 27 years long. You know? So I have made sure that I keep my blood sugar levels under control. Now also, like I'm on this, CGMS. I just put it on my body and monitor my blood sugar levels. You can see it's 121 right now, which is fairly controlled. And if you see, the graph is almost a straight line. It does not happen on all days. Some of the days are good days. And when your sugars are high, they can play havoc. So if you have been able to maintain your blood sugar levels over a period of time, you will be able to manage COVID-19. Trust me, the symptoms were not severe. My entire family, my mother, me, my father, we all were down with COVID. And my symptoms were, less intense than my parents.
I'm glad to hear that. I'm glad to hear that. And the reason I'm glad to hear that, Bhaavna, is because there are so many. I mean, there are millions or lakhs of, diabetes patients around the world whose experience has not been that good at all. In fact, many have, in fact, lost their lives. It is true, Dr. Shivdasani, coming to you, it is true that doctors advise that well-managed, if you manage your diabetes well, you've got a good chance of sidestepping the more extreme complications that are seen to be attendant with those who have diabetes as a comorbidity. How are you advising diabetes patients, ma'am? Because they're alarmed right now. For over a year, they've been alarmed. They feel much more vulnerable for a reason in this time of COVID.
So what I do for a living, my constant endeavor is to make sure that people are metabolically healthy, which means any of these lifestyle diseases, be it type 2 diabetes, not type 1, but type 2 diabetes, be it obesity, be it polycystic ovary in girls, be it fatty liver, all these which are comorbidities for COVID-19, all of them, diabetes heading that list. So we make sure that people control their hormones so that they're metabolically healthy. In America, for instance, only 12% of the entire population is metabolically healthy. I don't know the Indian figures, but 12% are only metabolically healthy, which is why that these are considered as comorbidities. All of these have a common denominator of inflammation.
Yes.
We know that inflammation is what kills in COVID-19. Which is why it's so important to control the sugars really tightly for a diabetic. Diabetic, pre-diabetic, polycystic, all of them have the same basis of having elevated insulin, of having insulin resistance. And the good news, I tell all my diabetic patients, because I like to focus only on positivity, is that you can make a patient, doesn't matter where you are on the health pyramid, doesn't matter whether you're an uncontrolled diabetic or whether you are a newly diagnosed diabetic, you can make a patient metabolically healthier, and you can reduce blood sugars in about a week of doing the things correctly.
Yes.
That's all it takes. So whether it's somebody who's seen me as an outpatient at the clinic or someone who's just reached hospital, I don't like to make sure that it ever gets to a state of ketoacidosis when I need to see a patient. That's not even my area of expertise. Right? My area is to prevent you from getting there. And I can say we do it in my clinic with great success. And these are simple lifestyle modifications. How difficult is it to control a patient's sugar? But we do know sugar is an inflammatory. We do know it is an immunosuppressant. We do know when you have elevated insulin levels, insulin is a vasoconstrictor. COVID-19 is a prothrombotic disease. So this is adding fuel to the fire. Take care of it and preempt a problem. Don't wait for a problem to happen full blown and then say
I'm going to poke that, what you said about trying to prevent and be prepared for such things also in my next round of questions. Before that, I want to bring in Dr. Akhilesh Sharma, who's also been treating many patients and advising them. Dr. Sharma, is the COVID diabetes link fully understood, or are experts still, figuring out, the data on this? Because like I said, the one thing that has been clear from the beginning of the pandemic is that diabetes is a major, major comorbidity, and it does increase the possibility by many, many factors of extreme complications, if not death.
Yeah, see, it's very important to understand that why there is higher risk in the presence of diabetes or high sugar. The thing is, sugar is the source of energy for our body.
Yeah.
If that energy is not provided because of the diabetes, then all cells, they slow down and their function becomes less. So immunity comes down, body's resistance becomes less, and therefore any infection will be overwhelming, particularly bacterial infection, viral infection, fungal infections.
Yes.
So we see that in the presence of diabetes, if COVID virus or any virus comes in the body, there will be a flare-up of the virus. And also, because of diabetes, the body immunity is less. Therefore, there are chances subsequently of secondary bacterial infection, sepsis, as you outlined in the beginning.
Yes.
And this is also one of the reasons that if the sugars remain high, it's kind of a fodder for bacteria, fungus, every organism that are around in the body. So you get more of mucormycosis, the black fungus.
Absolutely.
And so basically, a diabetic patient as such has higher chance of getting complication because of these infections. This is higher for fungal infections because in diabetes, what happens, there is associated acidosis, and therefore there is release of iron. So therefore, the mucormycosis flourishes in the presence
the
of
black fungus, which
iron.
we're seeing many cases of right now, doctor. Yes.
Yeah. So basically, what we need to do is that we have to control the diabetes very strictly, and if the sugars are going very high, probably an insulin therapy will be very helpful in controlling the sugar levels.
Yeah, absolutely.
And another issue that I just want to highlight here is that in India, the prevalence of diabetes is very high. And there are many people who are pre-diabetic.
We are the diabetes capital of the world, if I'm not mistaken, sir.
Yeah, we have a very high prevalence of diabetes. And there are many people who are pre-diabetic or who are diabetic and they are not aware of it. And on top of that, because of the stress associated with the disease and because of introduction of steroids in these patients to prevent viral pneumonias, they get higher sugars. And when they get higher sugars, there are more chances to get into ketoacidosis.
Okay. Yes, I understand. I understand what you're saying. I just want to, I wanted to ask both Chandani and Bhaavna also. Dr. Sharma, I'm going to come back to that point in just a bit. I wanted to discuss the post-COVID complications for diabetics also in a little more detail. But before that, Chandani, to you first, diabetics already are forced to have a very regimented lifestyle. They've got to be very strict about, their daily life. They're constantly checking their sugar levels and things like that. Did you have to change many things during COVID? Because already your life has all these barriers. During COVID, how did things change for you? Tell us your personal experience of how your day may have changed. Because you had this overload of information saying, as a diabetic, you've got to do everything you can not to get COVID.
Right. First, I'd like to emphasize on the word strict. It's not a strict lifestyle, to be very honest with you. It's a balanced lifestyle. And I would like to take the stigma away because if you look at every person who's trying to be healthy is following a diabetic lifestyle. So when it comes to COVID and the fact that I'm not able to leave my house, what I referred to my previous point before was a diabetic burnout. You're not going out of your house. You're not going to work. So then you're like, why should I look after my sugar? Looking after your sugar is also work at the end of the day. So the way I've had to manage it is trying to keep a very simple routine. And a routine does not necessarily have to be, oh, I'm going to wake up at 6 in the morning, work out. A routine just has to be a way to keep your body and mind active. So
Yes.
when your body and mind is active, you automatically will make more of an approach to keep your sugar in control. I would really like to emphasize this point that yes, you are a diabetic. You just need to take extra precaution. It's not a strict lifestyle. It's a healthy lifestyle.
I'm glad you pointed out the the stigma part of it, and I would openly
Right.
say that I learn these things as well, and I'm going to be the first to raise my hand and say that I'm happy to learn about these things. Being someone who is willing to know more about this. Bhaavna, what about your lifestyle? Did things need to change and become more regimented during COVID? As someone who has had diabetes as a condition for so long, how did things change during COVID? And you got COVID as well. That's why I'm asking.
Yeah. So Shiv, adding to just what Chandani has said, so it needs to be a balanced lifestyle. So we've been following that balanced lifestyle. It's not like, one fine day you get up and see, oh, the scales have gone up, my weight is increased and today I'm going to start dieting, or I'm going to start not dieting, but maybe have a balanced diet and start exercising. But for me, it has been a part of my routine, like everyday routine. I have been exercising ever since I was, 7 or 8 years old, or as long as I can remember. So adding on to whatever Chani said, you have a good routine, you have good food, you have a good diet, you have family support, doctor support, you have an insulin pump, you have CGMS system. Despite that, there are times when your sugars go up. So that is one part of controlling your blood sugar levels. The other very important part of controlling your blood sugar levels, which is completely ignored, especially in the Indian medical system, if I can say that, is patient needs to be away from stress. That is very, very important. Yes. And there is something called stress sugar, which is fatal. No amount of insulin is going to help you during your stress sugars.
Yes.
And that happens in extreme stress levels. It has happened with me as a personal experience. My father got sick and I was like running around the hospitals getting treatment for him. And that was when, my sugars were constantly above the basal line.
God, I can't imagine. Yeah.
And I'm pumping in insulin, and then I call up my endocrinologist. Like, it's been 6 hours, my sugar's just not going below 285. He's like, just relax, take it easy, don't pump in any more insulin. Insulin is not going to help you at this point of time. So it's really important. And when we're talking about type 1 diabetes, we're talking about children, we're talking about, kids who are probably just born, or, who are teenagers, or who are as old as 5, 6, 7, 8. They just don't know about all these things. So family support is really, really important at this point of time, for them to be able to manage type 1 diabetes. See, for me and Chandni, probably, we've grown our age, we've seen that part, we've seen this, but COVID is now hitting children, as young as 10, 11, 12. So it's really important for parents to give their kids a good support system for them to be able to manage diabetes. Let's be preventive. Let's be preventive in this case.
As much as possible, absolutely. Before I go back to the doctors and to you, Chandni and Bhaavna, I want to play out another report that we've put together for our viewers about how diabetes is one of those big comorbidities in the times of COVID, but there are other underlying conditions that could actually make things worse. So, for instance, if you have diabetes as well as heart disease, then things actually become more risky for you, and it could increase your chances of taking a much longer time to recover, and also more complications even after you recover. Here's a important report that you need to watch. Take a look at this.
They could be young, but their comorbidity is costing them their life. Medical experts are seeing a trend in those having comorbidities getting entrapped in a vicious cycle of disease that is leading to death. Often, the victims are in their prime.
People with diabetes, obesity, heart disease and kidney disease, etc. are not at increased risk of getting COVID infection. The risk is about the same as everyone else. The difference is that they have a reduced reserve capacity and poorer metabolism, leading to reduced immunity. Once the virus gets in, they are not able to mount a quick or strong enough immune response to reduce the virus and prevent it from replicating, so they have a more severe infection. Additionally, as the phase of inflammation starts, usually in the second week, these patients have very poor reserve and are not able to sustain such a strong inflammation, and the heart or kidneys can give up.
From diabetes to heart disease to patients landing up with black fungus and multi-organ failure, the complications are many. The government, realizing the huge burden of diabetes in India, the diabetes capital of the world, has now issued an advisory. But being diabetic itself invites a host of problems. Wrong use of steroids leading to black fungus, prolonged use of antifungal medicines leading to kidney ailments.
Patients who have in the background diabetes, blood pressure or heart disease, or who are obese, they are at a higher risk of contracting the disease and have a more fatal course. A lot of these patients, whether they are young or old, if they have diabetes or obesity in the background, have a more turbulent course. They land up on ventilator and generally have a poorer outcome.
But with over 77 million Indians diabetic, the burden is staggering. The risk of secondary infections are high in patients suffering from COVID-19 or even after recovering from COVID-19. Doctors say sugar levels need to be kept in check. If there is hypertension along with diabetes, one has to keep their weight in check.
They must follow the usual precautions of masking whenever outside their home, avoiding any crowded places, maintaining distance of at least 6 feet from anyone else, and using proper hand hygiene. In addition, it is important they monitor their own illness as well. Keep the sugars and BP under control, make sure the lab tests and doctor consults are done on time. For most chronic problems, doctor consults can be done online. Also, as soon as any symptoms of possible COVID infection develop, they must immediately seek medical advice.
Amidst growing concerns of deadly repercussions for those having comorbidities as far as COVID-19 is concerned, there is an opinion in a sense that these people should be getting the jab first. The initial plan of the Government of India had streamlined the process in such a way that those with comorbidities were getting the jab first. But since vaccination opened up for everyone above the age of 18, many such people are getting left out. And there is a concern that they continue to be vulnerable. In New Delhi, Sneha Mordani for India Today.
Dr. Shivdasani, I want to come back to you, keeping the spotlight on diabetes. How are you helping patients, prepare for this kind of thing, reverse this thing? I know you're focusing on the positive, and the best possible way would be to try and alleviate diabetes or remove it altogether. I don't even know if that's possible. Give us some insight into how you're advising and treating people, ma'am.
Okay. First of all, type 2 diabetes is lifestyle driven. So yes, more often than not, it is reversible. That takes time, but we're talking vis-a-vis COVID specifically.
Yes.
So we are looking at alleviating the problem and preventing and preempting the bigger complications from happening, right? So in which case we need to make sure that the sugars are under tight control, which is very simple really to do with just a diet. There are other lifestyle modifications that do make a difference.
Yes.
There's no question about it. First of all, let's understand that most type 2 diabetics are already obese, unlike a type 1 who can actually be really thin. But most type 2 are obese. Now, the fat cells, that the beer belly that we talk about in type 2 diabetics, the fat cells, they release cytokines. So, which is why we say that when you're diabetic, you're already in a state of inflammation.
Yes.
The cytokine storm, the so-called cytokine storm that we talk about. Now, imagine if you already have that excess cytokines, those cytokines sitting around your abdomen, and then you're attacked with COVID, then it's double whammy, because then your immune system is working on full steam, and very often it can't keep up. So then you're giving the patient extra sugar because it's fuel for your body. That is, in my opinion, wrong. You have to give more protein, natural, good quality protein, so you build the antibodies to fight the infection. You need to give good quality fat, and you need to reduce the simple carbohydrates. So all these juices that people say are very good for you, they're fruit juices, they're terrible for you. And if you follow a certain protocol of the anti-inflammatory diet, you can see a difference. You can see not just the blood sugars go down, you can see the CRP go down. And it takes 1 week. I make all my patients do this, all my diabetic patients. So it's there to see. I mean, the proof in the pudding lies in the eating, right? So, I mean, it's there.
Okay.
And this is not something that takes very long. We also need to realize a fair number of diabetic patients are also very low in vitamin D. Again, because their fat cells don't let the vitamin D get released from the fat cell into the blood.
Yes.
So they stay there. And we know that people with low vitamin D have they are immunocompromised.
Yes.
So if you're a diabetic, you must make sure your vitamin D is not on the lower side of normal, but on the upper side of normal. You must make sure that you're doing everything in terms of an anti-inflammatory diet. There are lots of things you can do, even lifestyle-wise, like I said.
Yes.
But it's possible, and we see this day in and day out.
Very, very interesting. And I like the fact that you've put out some of those specifics, and I'm sure people will benefit from that, Dr. Shivdasani. Dr. Akhilesh Kumar, what about type 1 diabetes? Experts around the world are saying that type 1 diabetes is much more of a risk factor as far as COVID is concerned than type 2. How are you treating your patients? Like Dr. Shivdasani said, that type 2 is reversible with certain lifestyle changes. Are there things that people with type 1 diabetes can sort of bring into their lives in the context of COVID-19 that they aren't already doing? I'm just curious.
I think the present issue is diabetes vis-a-vis COVID.
Yes.
And that should be our main attention at the moment. And type 1 diabetes is very, very uncommon in our country. But the type 1 diabetic patients, they are more likely to go into diabetic ketoacidosis.
Yes.
And if they go into diabetic ketoacidosis, then the COVID mortality will increase because of that. Otherwise, there is no additional risk in the acute management of COVID along with diabetes. But the crux of the problem is that in the acute stage, we should keep the diabetes very much under control so that we can avoid complications of COVID, as well as we can help in recovering of the patient very fast.
Yes. One more issue that I quickly wanted to ask you, doctor, since you are treating patients. There have been cases that have been reported from around the world of the onset of diabetes after COVID recovery, sir. Are you hearing about such cases? And what would you say about that? Because that is also fairly alarming for people who have COVID. They're wondering whether after they recover, they might get diabetes if they've been predisposed in any way.
Yeah, a very interesting question. See, firstly, we may not be aware that we are diabetic, and we get to know that we are diabetic now after the COVID infection. Number two, virus affects every part of the body.
Yes.
It's not just the throat and the lung. So it can affect certain organs in our body, including, say, pancreas. Certain viruses do it, and that can lead to diabetes. Then the illness of this COVID is so stressful that certain stress hormones are released.
Yes.
And that may lead to higher levels of sugar.
Yes, like Bhaavna was saying.
If we do a long-term study, then we would come to know whether there is a persistence of these high sugar, or they are there for, say, a couple of months and they become less. So that observation will be important to judge whether there is a permanence of diabetes after COVID, maybe involvement of pancreas or something, or it is just a transitory phase and then it normalizes, what you call as euglycemic state.
This has been extremely enlightening. Unfortunately, we are out of time. I had many more questions, but maybe we will do a part 2 of this same show very soon, and we'll invite more viewers to send in their questions as well. We've been flooded with questions here, I can tell you, during this show. So many of the questions that I asked were actually from our viewers. Wonderful to know. I learned a lot, which is probably the best kind of show that a journalist can do, when you yourself learn so much from the guests that you're joined by. So I thank all of you, the 4 of you, for giving me your time. I wish you the best of health. I wish your patients and your families the best of health as well. And thank you for giving us your time here. Thank you very much.
Thank you so much.
Thank you. Stay safe.
We're taking a very quick break. Coming up on the other side, we shift focus